You may not have an answer to this, but I'm just curious, like what would have helped if you, I mean, thinking back, what do you think would have helped you, I don't, either in childhood or throughout your life, or even as a nurse, that would have given you the space to share some of those feelings? And I'm sure we'll come back to speaking about that later in the episode. But if there's anything that comes, like what, yeah, what could really have aided you in these journeys? Because I think dealing with cancer or dealing with relationships, those are hard things on top of a very stressful job. Um, and it strikes me like neither of you, and I know myself, wouldn't have lifted my hand and said, "Listen, this is a little bit too much. I'm struggling." Is there anything that would have helped before it got to substances, maybe?
Well, I know for me, had I been taught that it was okay to have feelings and to talk about those feelings, I think that would have helped. I did seek out therapy off and on and tried to get help, but I was so uncomfortable with sharing my feelings that I didn't. I just continued to pretend like everything was okay and things are going really well. Yeah, I'm doing great. So the therapy was not very effective. But I think starting young, teaching our children that it's okay to have feelings. It's okay to show this is how you show that you have feelings, and to do that appropriately would be really helpful.
I would add the same, but I didn't know until I had a doctorate in nursing practice and dedicated my project to outreach to nurses that are suffering from a substance use disorder that it is 1 in 10 of us. And actually, after COVID, for nursing and critical care nurses, I think it's even more than that. It might even be more around 1 in 8. I think that if I would have been introduced to my risks early on, I could have maybe potentially made better decisions or had the courage to reach out. I think what Kristen said, though, was really significant. I came into nursing with a predisposition to addiction. I was born an addict. I was an addict since I touched alcohol at age 12. However, I think that the journey through my alcohol use disorder could have been a different one that could have put less people, less patients, and less families in the way of danger and dysfunction had I just known what my risks were, what the consequences to my use was, not only to myself, but to others. And if I could have just learned that in school, which we'll talk about, and then if I was introduced to that in the workplace as being more of something that was normal, or not normal, but more objective and factual, like, hey, welcome to the intensive care unit. We're so glad to have you working here. Here's a couple of things we would like you to be aware of and consider. You're at a greater risk of a lack of coping or coping in ways that could potentially be unhealthy. And here's what your resources are. I really had absolutely nothing to guide me in this drinking. It just remained a secret, and if anyone knew my secret, again, I thought my world would end, and it's just not the reality.
Yes, I mean, I'm reflecting about my own experience as I'm listening to you, and you're both having the education or the knowledge, the awareness of something, and then the support around that would make a big difference to all our journeys. Kristen, in your book, you wrote that addiction, as well as, or you've explained it as a progressive series of crossing one's own personal and professional lines or values. And can you remember some of the things you said to yourself before you were charged with the 26 felonies? You said earlier that even when you were confronted with it, everyone sitting in that room, you still denied it all. Can you remember what were some of the messages and the things you were telling yourself throughout?
That's a really good question and an important one, I think, because uh, denial is very powerful. I am a reasonably intelligent person, and I could tell myself things that were absolutely not true and believe the lies I was telling myself. Uh, one of the most, I don't know, one of the things in the beginning I would tell myself, I should also say, I am a very moral person. Like, I tell the truth. I don't have any, outside of these issues, I didn't have any legal issues. I don't even have a speeding ticket. I obey the rules, I obey the laws. But there was something about this drug use that, even though I knew it was illegal, I rationalized it and denied it was a big deal. So for the waste medication that I was stealing, I convinced myself it was just garbage, so it wasn't a big deal. Nobody cares that I'm taking the garbage. Nobody would care. Nobody will notice, which nobody did notice, but obviously it's a big deal. Anybody knows that. But I really had myself convinced it was no big deal. As I drove to work, sorry, start that over. Once I started stealing the fentanyl from stock, I would convince myself every day driving to work that I would never do that again, that I didn't need it. I just kind of gave myself a pep talk, like, you're not going to you're not going to take it. It's going to be fine. You'll get through the shift. Everything is fine. You don't need that anymore. And I really believed that I'd be good. And then the minute I walked through the hospital doors, especially towards the end, it was almost as if I was pulled into our little office where we kept our transport packs, where the drugs were stored. I was almost pulled there. And as I was walking towards that door, I would be saying to myself, I just need it one more time, just one more time because of XYZ. Like, I always had a reason that it was really important just for this one more time. And then I will never do it again. And I absolutely believe myself that I would never do it again, that I was just going to do it one more time. I also convinced myself that nobody would notice. Like, nobody will notice that I've changed the drug log entries. We used paper back then. They wouldn't notice that. They wouldn't notice that the fentanyl was missing from the pack because I had broken the ampule and put it back with some saline squirted in there, so they would just think it got broken. Like, nobody's going to notice that. They won't look into it. They'll just, like, I had myself convinced that all of these things were true, even though also I knew that none of them were true. So it's just that denial is really weird.
April, you said the light went on for you when your mom made a comment to that. Can you tell us a little bit more about what was that turning point like for you? I mean, I'm sure you can reflect on what Christine is saying around how you were rationalizing, justifying it, but what made it switch for you in your mind?
What ended up happening for me is I was physically at my worst and unhealthiest. I was, like I said, I was turning 40 years old and I could not even get up the stairs without stopping to take a break to get my breath. I was full of fluid. I had pitting edema in my ankles. My blood pressure and my pre-diabetes checks at the doctor were out of control. They were getting me recommending medications. I was spiritually broken. My children did not like me and were very hurt and angry with me. Unfortunately, my children saw me drink. My marriage was failing. I had quit my job as a nurse manager, not because, again, not because I was in trouble. On paper, I made it through. I had no licensure problems. I had no corrective action problems. I had no challenges when it came to that part of it. But I was dying. Honestly, my spirit was dying and my body was dying, and I was 40 years old. I was supposed to be to work one Monday morning. I took a different position after I had stopped the nurse manager role willingly and voluntarily. I took a different position and I was supposed to be at work that day. And I couldn't go to work because I was so sick. I was so sick. And I sat on my mother's bed and I was in between two places, going to a hospital and getting the help that I had provided for so many patients in my 20-something year of nursing and critical care. I knew that I needed some Ativan or I needed another drink just to get through that Monday. And I couldn't do either. I couldn't go to the hospital and ask for help and get on an Ativan drip, and I could not drink more that day. So I went to my mother's bed and I just sat there. I didn't even have to talk about what was happening with me very much because she knew. And we sat there together for a while, and I was so sick, the sickest I had ever been. And she just looked at me and said, "May I make a suggestion?" If she would have said, "I think you need to do A, B, and C," if she would have said, "You are a failure, you are horrible, you are shameful, you are disgusting, get a life." She didn't do any of those things that many people will default to saying to someone who is in such a horrible position. Instead, she said gently, "I'd like to make a suggestion that maybe, just maybe, your alcohol use is a contributing factor to all these problems that are in your life." And that's when it's almost like the heavens opened and I could see the light, and I knew I was in an AA meeting that night. And like I said, it's been 8 years since. It hasn't been an easy 8 years. There was a relapse in there, and it wasn't smooth and it wasn't easy. And with the combination between the AA, Alcoholics Anonymous, and the Marie Manthe from the Minnesota Nursing Peer Support Network, and that nurse standing up and saying she had the same issue that happened to her, I hung on to that, and I made it so far for today.